Welcome to the MamasteFit podcast. In this episode, we're chatting with Dr. Sterling, who is an OBGYN all about advanced maternal age. We're going to discuss what are the risks of advanced maternal age, what are some ways that we can mitigate some of those risks, and how can we navigate conversations with our provider in the current medical model. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit podcast. In this episode, we have Dr. Sterling, who is an OBGYN that's going to be talking all about advanced maternal age, which is something that is near and dear to my heart right now because I apparently am in a geriatric pregnancy with my fourth. And this was something that was bringing me a little bit of heartburn. So I'm really excited to have you here, Dr. Sterling, to talk all about what it actually means and what things I actually need to be afraid of right now, if anything, which I think is probably nothing. So thanks so much for coming on the podcast.
Oh, thanks for having me. This is one of my favorite topics. So, anytime I'm asked to speak about advanced maternal age, I jump at the opportunity.
I'm really excited. So can you introduce yourself to our listeners?
Yeah, so I'm Dr. Sterling. I'm a board-certified OBGYN. I am also a mom of three. I have three little ones ranging in age from 7 to almost 2. And I'm really passionate about educating people about the importance of whole person wellness in pregnancy and really throughout those baby-making years, and reducing stress, reducing anxieties and worries so that we can, take care of ourselves and our babies and all that fun stuff.
I've definitely really enjoyed all your content on Instagram because it felt like it comes from a really unbiased position of informing people on like different options and like kind of in either direction. And I feel like that's what I'm always seeking when I'm working with a provider, especially during this time of my life, is I want someone who's going to give me my options and then help me make decisions that work best for me as an individual, as opposed to, hey, this is what the guidelines say. Like if you're at this many weeks or if you're at this age, here's all the problems that you now have. So the thing that I found on my chart recently was problems, advanced maternal age. And I was like, wait, why is this a problem? Like, why is this listed as a problem? And I'm sure it has something to do with like insurance and billing. And I know that there are more tests that are available to me now that I'm like really old. And I'm
so old.
Just so
Just
old.
the oldest.
So could we start with just defining like what advanced maternal age even means, like based on like the literature and like the guidelines?
Yeah, I think that's a really great question. So it actually depends on who you ask. It's not a universal recommendation. In the United States, the American College of Obstetricians and Gynecologists has defined advanced maternal age as anybody who's going to be 35 years old or older on the day that their baby is due, their estimated due date. Some of the literature, talks about advanced maternal age as 40 plus. So there's definitely, we have to pick an age where we make a cutoff. Nothing magical happens at midnight when you turn 35, right? But that's how medicine is. We pick a number, we do a cutoff. But I will tell you that there's advanced maternal age in that like 35 to 39 realm, and there's things that we do differently for sure. And then there's advanced maternal age 40 and up, where we manage it even differently. So even within the diagnosis of advanced maternal age, there's still some nuance in how we're managing those pregnancies.
What are some of those things that someone could expect that their provider may offer to them or like bring up, like if they are advanced maternal age, if they're 36 versus like 41?
Yeah. So, the thing is that as we get older, and this is true of health in all the ways, our risk of everything goes up, right? And so some of the risk that we see with advanced maternal age isn't necessarily related to pregnancy. It's just that somebody who's 35 is at a higher risk of coming into pregnancy with something like hypertension than somebody who's 25, okay? So some of it is just kind of how you come into pregnancy. And so if you come into pregnancy with other medical conditions, we're going to manage those medical conditions kind of regardless of your age. If you were 35, if you were 25, we're still going to manage those medical conditions. And then we see that even for people who, we look at two people and they have, the same medical condition or different, no medical conditions, we see that there's still some increased risks associated with just age. And one of those things is genetic abnormalities, so chromosomal abnormalities. So we see in people who are below 35, oftentimes, not all the time, but sometimes insurance won't pay for the best test that we have, which is a non-invasive prenatal test, the NIPT test, to screen for chromosomal abnormalities. But then once you hit that 35, they're like, okay, yeah, we'll pay for that. But we typically still offer it to everyone because it's just a better test than what we had before. So that's actually, to me, that's a benefit of advanced maternal age. I was super bummed when I missed AMA by like 2 weeks in my second pregnancy because then I had to foot the bill for my NIPT test, which I knew I wanted to do. So, there's things like that. Then there's, we can talk about antenatal testing. We can talk about offering inductions of labor. There's different things that we offer. And my perspective on it, as long as we aren't making the diagnosis seem really scary and stressing people out about it, I think that sometimes having that on your chart just means that people are a little bit more alert to like, hey, is this blood pressure normal? Or should we maybe take it again? Where somebody who's like 22 are just, oftentimes they're just assumed to be healthy and our radar, our like spidey sense isn't on them as much. And sometimes, that's not a good thing. So it depends on how you use that diagnosis, if that makes sense.
I was offered the NIPT. I thought it was called
I've been calling it the NIPT test like my entire
NIPT,
career.
that's totally
and
fine.
when you called it the NIPT test, I was like, oh my God, that makes a lot of sense.
I mean, it's
I been
it's
wrong?
an easier way to say it, right? Yeah. People call it NIPT though.
So I was offered that at my last appointment, and it was the first time that I had been offered it, which I thought was really cool because I was like, oh, like we already had done a blood test for gender, so we were able to find out what the sex of the baby was, which was, but we already knew. But that was like, oh, that's a really cool thing that I knew was offered with this test. And then like having all of this like information to know, okay, everything is developing really well was like really helpful for me. I did find that at my prenatal appointment with the midwife, she brought up like advanced maternal age and then discussed all the risks associated with being advanced maternal age. And then she was really quick to dismiss like, hey, like your prior pregnancies have been low risk. Like this one appears to be very low risk. Like I'm not too concerned about it. But there was definitely a big emphasis on all the bad things that could happen now that you're really old.
Yeah.
And so I found myself really anxious after taking the NIPT test of like, well, what if something's wrong? Like she spent all this time talking to me about all the bad things that can happen because now I'm suddenly really old. And I had just turned 36 like 2 weeks prior to this appointment. So I'm like, I didn't think I was that old. Like,
So
what do
old.
you mean? And so, but I found myself very anxious waiting for the results of this test. And I didn't expect being told that I was advanced maternal age, which I think is better than saying geriatric pregnancy.
Oh, 100. Geriatric is
it's like, oh,
a weird term to use.
yeah, like at least I got that. But I found myself like really anxious about it for some reason. And I think maybe like I didn't fully like mentally accept that this was like something that was on my chart now and like what it meant. But I was like, oh my God, what if there is an issue? Because now my eggs are really old. Like, and it was like this new mental like thing with pregnancy that I wasn't expecting. Like I almost felt like I was above it. Like this is not going to bother me. I know it's not a problem for me. I am not old. But it bothered me so much, and I was like, it annoys me that it bothers me. Like this is a little frustrating. Like we joke about it, but it's different when it's actually like written.
Let's take a break from this episode to learn about our podcast sponsor, Needed. Needed is a nutrition company focused on the perinatal timeframe that both Gina and I have used during our pregnancies and postpartum. And one of their newer products is their egg quality support. Did you know that your eggs take about 3 months to develop? And then when you're, so old at 35, we need all the support for developing those eggs as we can. So Gina, tell us about your egg quality support.
When my husband and I decided that we were going to try to conceive our 4th baby, we decided to start taking Needed's egg quality support bundle, or I was taking it. He was taking their sperm support bundle. With the egg quality support bundle, they have their egg quality supplement and then also their CoQ10. And the combination of the two can help to improve your egg quality. And so because I knew that I was technically going to be advanced maternal age for this pregnancy, I wanted to ensure that everything that I was doing pre-pregnancy to prepare to conceive was going to be in my best interest, and I was taking Needed supplements to help support me in my trying to conceive phase.
Needed is a product that we both utilized during our pregnancies and postpartum. They're very intentional with all of their research and product development. And if you want to try them out, you can go to thisisneeded.com and use our code MamastePod to get 20% off your first order or the first 3 months of your subscription. Let's get back to the episode.
It's really important to provide people with accurate information, right? Everybody deserves to be appropriately educated about their risks, etc., in pregnancy. But we also want to do it. I find that sometimes we talk about it, it's like it's punitive. It's like, well, since you decided to get pregnant at 37, now we're really worried, as opposed to, okay, this is a number. This is a piece of the puzzle. We don't want to ignore it because that's bad medicine. We don't want to ever ignore risk factors. But we want to empower you to feel like, yeah, because we know your age, we can look at things a little bit differently, and we can empower you that there's a lot that we can do to mitigate the risks of advanced maternal age, right? So I think that it's all about how we as providers, meaning how we deliver this to the patient, because you can give the exact same information and it can leave the person to go home and be totally freaked out and be Googling and asking all of their friends, or they can feel like, hey, you know what? I'm so glad they brought this up because I'm going to see this on the internet and I have the information. I've been educated about this so that post isn't going to scare me because I have a plan with my provider to appropriately address this risk factor. And they've explained to me that it's just one piece of the puzzle. It's not the whole picture,
Absolutely. She did a good job of explaining it to me. I didn't leave the appointment terrified. I was just kind of well, that was she kind of talked about the risk factors for a little bit longer than I thought she would. And then she was like, but you're fine. And I was like, oh, okay. And then it was on my chart and I was like, this is a problem? What do you mean this is a problem?
I know. The problem list, it's so hard because it's they're not really always problems that they're listing, but they're just things that occurred during your pregnancy. So low-lying placenta was problem on my thing forever, but it resolved by 27 weeks. It was gone, but it still just said low-lying placenta right there on there.
Yeah, I think it was because it was listed as problem. It was just what do you mean?
Words are so powerful, but it's also hard in medicine. There are certain words that we use for charting purposes that maybe not the best.
I would have never noticed if I wasn't trying to print out my lab results to give, because I'm giving birth at home. So I printed out my labs to give to my home birth midwife. And I was like, what do you mean? Why is this on my chart? So if I would have never known if I didn't have to print them out for any reason. But yeah, so I'm really old now. So what are the risks that people are prencerned about when it comes to advanced maternal age? What are some things that someone may encounter more frequently at an older age during pregnancy? And then also what are some things that we can do to mitigate some of these risks as well? Because I think there's a difference between me as a 36-year-old versus somebody who doesn't exercise. And I mean, I do eat McDonald's and Chick-fil-A, but if I don't eat it every meal kind of thing. But
you don't have chronic hypertension or
I didn't
diabetes.
go into pregnancy with significant medical issues. I do have a little bit like a thyroid thing going on, but
So you
like
do have hypothyroidism.
but overall, I feel like I'm a pretty healthy 36-year-old. I know not everyone who's my age is the same level of health as me. And so I would think that the two of us going into pregnancy would be different and hopefully be treated differently, even though we're the same age. So I guess what are the risks and like what could someone do to kind of mitigate some of those risks?
Yeah. Yeah. So we talked about one of the risks which is an increased risk of chromosomal abnormalities. With that, we can't really do anything to prevent that, but we can diagnose it early, and that gives people options. And I think that even if, you're not able to, you're in a state where you can't execute those options or you don't want to execute those options, that knowledge in advance is a game changer. So I'm a big proponent of everybody doing genetic screening. So there's the chromosomal abnormalities, and then there's the most common things we think of are blood pressure issues. And that is, yes, people who come in with hypertension, but also people who come in with totally normal blood pressure, never had a blood pressure issue in their life, at a higher risk of developing a blood pressure issue in pregnancy, increased risk of preterm birth, low birth weight, and then unfortunately things like stillbirth. And those are kind of the main things. And then there's like a lot of like smaller things that, we don't need to run down the whole gamut of like and scare people, because really those are the other risks are much more minor and much rarer. Those are the main ones. And so from a blood pressure perspective, advanced maternal age is a moderate risk factor for developing preeclampsia. So if you have one other moderate risk factor, or if you have a high risk factor, then you would be a candidate for low-dose aspirin for the prevention of preeclampsia. And that low-dose aspirin is amazing. Like the data on the benefits of low-dose aspirin in pregnancy are really quite remarkable. So some people don't know, but for example, if you are on your first pregnancy, which I know you're not, but if you're on your first pregnancy and you are 35 or older, you're going to be 35, that in and of itself qualifies you for low-dose aspirin to reduce the risk of preeclampsia. So if you are, in the realm of being advanced maternal age, definitely talk to your provider about low-dose aspirin. And then for things like preterm birth, I strongly recommend people, when they get their anatomy scan, make sure that they're measuring their cervical length. So that's part of the ultrasound. It's pretty standard. It's not completely standard, which is why I mention it. And that's something that if we see like, oh, your cervical length is shorter, there's interventions that we can do to try to prevent preterm birth. And then kind of one of the things that I think we need to be spending way more time on. By the way, I have an entire class that goes over all of these things. So if somebody's like trying to write this down vigorously, I have a free class, and I will share the link at the end. Don't worry. If you don't remember any of this, I have a class that goes over it. So one of the things that I think we should be doing for advanced maternal age pregnancy, and really all of pregnancy, is to be really protecting pregnant people from stress, because we have a large body of data that tells us that stress in pregnancy is linked to pregnancy outcomes. Many of the pregnancy outcomes that are also linked to advanced maternal age, and also long-term health and development of baby. And it kind of blows my mind that with all of the data we have on this, that it seems that every pregnant person in the world knows that they're supposed to avoid unpasteurized soft cheese for listeriosis, which is terrible but rare. And so few people know that there is a abundance of data that tells us that stress in pregnancy is not good. And we really need to be protecting people from stress, anxiety, and all of that in pregnancy. And unfortunately, the healthcare system oftentimes does the opposite, right?
I was like,
to
way
stress.
to increase stress. You are old.
I know.
So old. You cannot grow a placenta or a baby. But don't be stressed about it.
You're fine. You're fine.
That's exactly why how we talk about it matters. It matters. And that's why I'm so passionate about education, because I really believe that for a lot of us, the not knowing, the trying to figure out, trying to Google and figure it out, that's what's causing a lot of the stress in pregnancy. And so if we can be upfront, have a really robust education so people have the information that they need to navigate their pregnancy, feel confident about the choices they're making, I think that's a game changer.
Absolutely. So I had a appointment with my PCM. So he's not an OB. He's I don't know. He's just a doctor. I know he's not just a doctor. I don't know what type of doctor he is.
I think he's like
he might have been an internal medicine doctor at some point, but he's just my primary care provider. And I've been working closely with him for like I have hypothyroidism. And so we've been working, especially during my pregnancy, to adjust my medication and ensure like my thyroid is working really well. And one of my recent labs that I did at the OB clinic, my antibody levels for my thyroid were elevated. And so, of course, I go on Google because I have my PhD over here, and I'm over here freaking myself out because, like, first I get told, oh, I'm at a risk for preterm labor because I'm old. And then, like, Google is like, you're dying. But the risk of the elevated antibodies is also preterm labor. And I'm like, I'm screwed. My baby's going to be born tomorrow. So I'm like spiraling in despair. And fortunately, I had my appointment the next day with him to go over my medication and do additional blood work. And he was like, let me talk you off the ledge. Like, take like 10 steps back. Like, let's go over the lab work. Like, your thyroid levels are looking really good. Like, the the dosage that we're doing is perfect. Like, this is why I don't think these antibody levels are that big of a deal, like, because all of this other stuff says it's great. Like, please stop getting this tested. You don't need to get this tested. Like, it's not as useful as we think it is. And I was like, okay, I feel much better now because he is a provider that I trust. Like, I don't need to do all of the research on every little thing because I have chosen a provider that I trust to help guide me through my medical decisions. Now, this doesn't mean that I need to go in like just like blindfold myself and just like do whatever you want to me. Like, I like know my preferences, but I'm trusting him to help guide me to figure out like the nuances of things because Google is not helpful. Like, I could read all of the research articles
all the time if you Google.
I don't know what some of this stuff means, and like from his experience, I know.
Nor should you.
Yeah,
you didn't go to medical school.
Yeah, I'm like, I don't know what this medication means, and so I felt so much better after the appointment. And so I did like an Instagram story about it, and I was like, hey, this is how I feel. And then this doctor messages me, and she's like, well, your antibody levels are a really big deal. And I'm like,
and that's it.
And that was the whole message. And I was like, first of all,
oh my God.
I went to my provider who has my medical information in front of him. He's looking at my labs, and he went over with me what was going on and why, for me, this is not a big deal. You don't even know who I am. Like, how dare you go in my DMs and be like, actually, this is a huge problem. Like, I just explained that this was something that I was panicking about. He reassured me because he's a provider that I trust. And then you as a provider think that you need to give me medical advice via DM based on like a 30-second story. And so I was just like, what is even happening here? But it was...
On behalf of all providers, I apologize.
Oh my goodness. But what I found to be really valuable from that experience was, I don't need to know every little thing about every medicine and everything about my thyroid and everything about advanced maternal age if I'm choosing a provider that I trust to guide me through it. Like, it doesn't mean that I'm just blindly going with whatever they say, but like, if I felt like I couldn't believe the things that my provider was saying to me, like, I need to find a new provider. And if I'm seeing a provider that's making me anxious and uncomfortable at my appointments about being old, then I need to find a new provider. And so fortunately for me, I have my home birth midwife that I see regularly for my prenatal care, and she is very reassuring about it. She's definitely takes her job very seriously. Like, it's not like home birth or bust or anything for her. But like, she just makes me feel so much more confident about my ability to give birth. And I trust that if there is a complication that arises, like, she's going to be very clear with me to say, home birth is no longer a safe option. Like, we need to transfer to a different facility so that you can be safe. But that's something that I've chosen with this provider. And so I think that's something that's really important. But
yeah. Trust with your provider is huge. Yeah.
It's so huge.
It can make
And
or break
it's,
so much.
It can make or break so much. And I do want to say that I think the thing that's so sad to me as a provider about everything, about our healthcare system is like I know these OB providers. Like I know them intimately. They're my best friends. They're my people. And I know how difficult, I know how few of them feel like they're really able to provide the care that they want to provide in this system. And this system it's harming patients and it's harming doctors, and it's harming nurses. All of us are in this really messed up system that, having 10-minute prenatal appointments is just, it's not enough time. I don't think it's enough time to adequately address somebody's concerns and talk to them about what to expect next. Because my big thing is a lot of the anxiety and worries and stress of pregnancy is predictable. I know, the things that people worry about are actually pretty consistent. And you can predict what a lot of people are going to be worried about at 16 weeks, at 20 weeks, at 24 weeks. And because we can predict that, if we had enough time, we could actually say, hey, this is what's coming up next for you. You might have these questions. Here are the answers. And that's one of the things that was really important to me. One of the reasons why I exited the healthcare system to address some of the issues within it is because I was like, we can do this. Like we can, I can build something that helps address people's concerns before it's added to their mental load. It's actually not rocket science to do that. It's something that can be done.
Absolutely. I definitely find, like, especially when it comes to pregnancy and birth, the things that we don't understand are the things that we tend to be really afraid of. And that's something that we focus on in our childbirth ed course as well, is when you understand what is happening, it's a lot less scary. And that's the same throughout the pregnancy. Like, if I had time at, like, my first pregnancy's prenatal appointments to, like, really sit down with my provider and be like, what is even happening in my body right now?
Yeah.
Like, I'm so confused. My app is telling me it's the size of a strawberry. Like, what does that even mean? Like, that would have been so helpful for me during my first pregnancy. It just felt like I was kind of like rushed in and rushed out. And then towards the end, I was like, I actually have no idea what's going on. And I should probably take a class or something because I am
32 weeks.
Very overwhelmed. My second pregnancy, they had a centering class that was offered, which was like a 2-hour prenatal appointment, it was a little long, but it was cool because, like, the first hour, like, you had, like, a nurse and a midwife, and we would all, like, do each other's vitals, and then she would check on baby, and then we would have some time to chat with her, and then it would be, like, an hour-long, like, educational class on pelvic floor PT, like, prenatal nutrition, and so they'd have different experts kind of come in and teach, like, topics that, like, people want to know about during their pregnancy, and you got to connect with other moms, which I thought was really cool. And then for my most recent 2 pregnancies, we're doing home birth. And so those, like, the community birth, like, prenatal appointments tend to be a lot longer. But there's not that many providers that provide community birth. Not everyone can afford to give birth outside of a hospital setting. Like, it's really hard to compete with, like, free in the hospital with your insurance, or, like, so I think people have deductibles and stuff as well versus, like, paying out of pocket for a community.
And so many
like,
people risk out.
Yeah. And it's like, and then if you risk out, well, now you have to pay 2 providers because you got to pay your home birth midwife and the hospital provider. And so it's like, it's really easy when I see folks say, like, oh, well, just give birth somewhere else. Like, go give birth at home.
It's
like,
not an option available
and it's
to
like,
everybody.
It's not what not everybody wants that. Not everybody wants to give birth, not in the hospital. Not everyone feels the safest, just like you didn't feel safe giving birth at home. And then not everyone can, like, it's not feasible for everybody. One, there might not be enough providers, or it might not be financially accessible, which I think are important things to acknowledge.
And some people want an epidural. You can't get an epidural.
You can't get an epidural at home.
Let me call my
I've done it.
anesthesia.
I've done it
I'm
both
ready for my
ways.
epidural. I live at this address, please.
I'm ready.
That was me showing up for my second birth. I did it without an epidural, no intervention with my first. And my second one, I told the nurses, I was like, I'm going to start doing infomercials for epidurals now because this is amazing. I love this birth experience.
It's really hard to beat that like epidural nap. Like I had an epidural for my first, and I was just like, like
When you
it
like
was
people
so
wake
nice.
up and they're just like, "What year is it?" I feel like I was asleep
Yeah,
for like
am I?
9 years, and I was like, "You were asleep for 49 minutes. Do you feel rested to start pushing now?"
I love it.
But I do feel that there is like this frustration that I can see with providers of like, I want to provide a different type of care and I cannot, because I cannot be a private practice with like the debt that I have as a student. Like I like cannot physically spend more time with patients and then meet the volume that I need to like meet like as a part of this clinic without being fired. And so it's like it's so like heartbreaking to me, because I like to believe that the majority of people that enter medicine, and especially the ones that are entering the OB field, are coming from a really wonderful place of wanting to help and to support their patients, to keep everyone safe. And it's so sad to me when I see like content about that are attacking OBs and saying how horrible they are. And I'm like, I think it's the system that's making it really hard for them to provide the care that they need to. And it's also making it really hard for patients to receive like the treatment that they feel they deserve. And so that it becomes this like weird dynamic where like, yeah, our medical system needs some.
You would think though, like that the rate of like malpractice, like claims and cases that come out of the OB world, that they would be like, I feel like we should probably make a change of some sort, because I feel like some of those cases, all they needed to do was like have conversations with people.
Yeah.
To like, one, understand what just happened with your birth and like what is
Yes.
happening with
Yes.
you or your baby, and like have a normal conversation with somebody so that all of their questions are answered. They feel heard and listened to. And that's not always the case. Sometimes it's like they're just gaslit after these things happen to them. And that's what leads to these litigations, because they're like, well, someone's going to listen to me and I'll make them listen because they did something wrong. When it may have just been
100%.
like an honest mistake, but nobody wanted to like own up to it in a way, or like just talk to them. But I feel like we've gone down like some crazy.
No, but I mean, it's all mixed into one, right? Like it's all this organism that we're trying to exist in, and of course, you know, you are 100% right. If a trauma happens to a patient or something happens in their birth, and they don't get the debrief, and they don't ever understand what's happened, and they have to, you know, that is a recourse that a lot of patients end up having to take. That if somebody had just even said, hey, I'm sorry that this happened to you, you know, that would solve a lot of it. And that's the thing, is that the system is dehumanizing to both patients and providers. And that's why, you know, providers, my generation of providers are dropping out of the healthcare system. I mean, I dropped out, are dropping out at alarming rates. And we're going to have a very serious physician shortage, because people you're burnt out. You care. You went into it because you care. So you either stop caring as much, which is what we call moral injury. You stop caring as much, you get burnt out, and you have compassion fatigue, or you just live with the fact that you never feel like you are doing what you set out to do. You're never meeting your own standards of care. I'll tell you from personal experience, it's not fun.
Man, it's like it's heartbreaking to like know that this is happening, and then also to not know what the solution.
Yeah, like we know there's a problem, but like how do you fix it? Like I think centering is like a really great option that's just not offered, and I feel like that would be a really great, especially when it's people's first pregnancies. They have all these questions, so many questions during pregnancy, that like a centering group could answer so many for people, but it's just not offered. It's like not feasible for one provider to be sitting in one room for 2 hours with however many patients. And a lot of people can't just take 2 hours out of their day. Granted, like when you go to your prenatal visit, is it actually 15 minutes? No,
Yeah.
You're there for like 2 hours
You're
anyway.
there for the
because you gotta get your weight and your labs and like your vitals. So maybe it's still feasible. Like it's more feasible than we think it is to do like centering, especially those first pregnancies. And then like if you had like a complication, like if you had preeclampsia or gestational diabetes or any of those complications, like you could be in a group like of people who also have that. So you feel less alone.
Yeah, that would be amazing. Most centering pregnancy is only for low risk patients because they're not addressing those other aspects of it. But yeah, if you had a large enough patient volume that had those diagnoses, that would be something that would be amazing. And I took a lot of inspiration from the idea of centering pregnancy because it's something that I think is really cool when I created my company.
Yeah, which I think it's such a cool offering that you offer because, yeah, not everybody can get that from their providers because they only have 10 minutes. And that's one of the things that's like makes me nervous. So I'm in school to be a midwife and I'm like, what am I going to do when I leave school? Like I have to work somewhere, but I feel like it might just dampen my fire, which I hope it doesn't. But
I still tell people, I'm still glad that I did this. I'm still glad that I became a physician. I'm still glad that I took this really weird path to get where I am. And that's the thing about going into OB or going into midwifery or doing any of these things when you're up against this giant behemoth that you're like, I'm not going to slay that dragon. How am I going to exist in this system? Is you will find a way to make the difference that you are supposed to make. And I knew all of this kind of about the system going into it. I didn't have the lived experience of knowing what it feels like to operate in this broken system, even though I knew it was broken. And for me, I was just like, I have friends who are fighting the system from within. And I'm so happy that we have providers who are like, I'm going to do this. I am too impatient. And I was like, I am not going to chip away at this problem from inside my entire career. I will lose my mind. I was, 3 years in to private practice and I was losing my mind. And so I was like, I'm going to be someone who's going to go around it. But we all find our own way to kind of address the need that we were meant to address in the world. At least I'm Jewish, so that's our belief. That's my spiritual belief as well as my belief as a physician.
So back to advanced maternal age, even though I think the conversation about physicians' burnout is really valuable to helping people understand their providers as they go to their prenatal appointments, because I think it's really important to understand like the reality of the type of care that you may be receiving because of the system that you're birthing in, which is, it's unfortunate, but it is still the reality that we should still paint an accurate picture on what someone may expect. Something that we saw brought up a lot with advanced maternal age was I'm advanced maternal age and I got IVF. Is that an increased risk factor if somebody does have IVF and they are advanced maternal age? Because that was something that we were seeing repeatedly.
A lot of people were saying that I have to be induced because of all these risks of IVF and being advanced maternal age.
Yeah, so IVF pregnancies are higher risk even if you're not advanced maternal age. So for example, we know that people who go through IVF are at higher risk of developing a blood pressure disorder of pregnancy. And we think that is because the evidence and the data is kind of pointing us to placental development as one of the kind of root causes of blood pressure issues in pregnancy. So we see that when people take low-dose aspirin for the prevention of preeclampsia, when they start taking it before 16 weeks, we see an improvement. And after 16 weeks, we don't see the same benefit. And we think that it's because it's impacting that early placental development. And the placental development is fundamentally different when you have a quote-unquote natural conception versus an embryo transfer.
That's really interesting. There's also, we saw some data that exercising in the first half of your pregnancy can positively impact the placenta development as well. And I think it's this is that time that the placenta is kind of setting its foundation for the pregnancy. And so exercise in the first half of pregnancy is really impactful. So it makes sense that taking that low-dose aspirin to help with placenta development can have a really positive impact as well. But that is interesting that IVF does have a little bit more of a risk, potentially, not necessarily that similar to advanced maternal age, like just because you're like labeled this does not mean that there is an issue, but like there are some things that your provider is looking out for a little bit more. I like what you said at the beginning where, it's not necessarily a problem. However, like their spidey senses are a little bit more aware of like potential issues and how this could actually be a benefit for you. So all this like reframing is selfishly like very helpful for me right now.
I'm so glad because I think that we just have to switch. If we can just switch the way we think about risk factors from not necessarily being this bad thing, but it's like this is a piece of the puzzle. Most people who are advanced maternal age who have IVF pregnancies have totally healthy pregnancies, right? That's the most likely result is everything is going to be totally fine. So if we keep that in mind, and this is just a piece of the information that we're going to use to try to get you the best possible outcome, I don't know. It feels better to me. I think it feels better to a lot of patients.
So with advanced maternal age always comes that people need to be induced at 39 weeks because you're so old. Like if you continue this pregnancy, you have all these risk factors. Like you didn't grow a very good placenta, so we need to have this baby. It's always like what people are like, I'm really old. I need to be induced at 39 weeks. Like my provider will not let me go past 39 weeks. Like 39 weeks for some reason is like this like time that all inductions happen. So what is the reasoning? And it's like, is it evidence-based as well as like, what are the risks of going past 39 weeks potentially if you are advanced maternal age?
Okay, so I first want to answer your question of why are all inductions 39 weeks? And the reason where you see a lot of 39-week inductions is because at that point, up until 39 weeks, there's a benefit to baby for every week of pregnancy, assuming all is going well, and there's a continued benefit. Once we get to 39 weeks, babies born at 40 weeks don't do better than babies born at 39 weeks. So we're like, okay, it's, babies, quote unquote, fully cooked. Doesn't mean that they can't, there's not, more weight that they can gain, et cetera. But we don't see a difference in outcomes between 39-week babies, 40-week babies, 41-week babies. So that's where we induce earlier than 39 weeks all the time when there's something up, when there's a problem that we're like, it's safer for baby outside, sometimes even outside in the NICU than continuing the pregnancy, right? So 39 weeks is this time where some of the softer indications for induction are offered. Now, it's pretty unusual for someone to be told just based on being 35 that they have no other medical problems. It's not necessarily evidence-based to tell that person you have to have an induction. What the data tells us is that we know that people who are advanced maternal age have a slightly higher risk of stillbirth. We know that your risk of stillbirth is going to go up slightly after 39 weeks. So we've done studies that say, okay, if we induce people who are advanced maternal age, are we going to reduce the risk of stillbirth? Those studies, because stillbirth is so rare, didn't have any stillbirths in them. So we can't say if it reduced it because it didn't happen to anybody, which is yay. Like,
yeah,
it's like, okay, we don't have the data.
Research.
Thank goodness we don't have the data, right? It's a good thing. But what we saw was, well, it doesn't increase people's risk of C-section. And so that, for a lot of people, was like, okay, we don't have the data that specifically says induction, we know, reduces the risk of stillbirth, but we know that the risk of stillbirth at 40 weeks is higher than the risk of stillbirth at 39 weeks. We know that at 39 weeks, an induction isn't going to raise the risk of C-section. And we know that baby doesn't have improved outcomes at 39 weeks compared to 40 weeks. So for somebody who's 35 plus, oftentimes we'll say, hey, this is an option for you. Where I delivered, they were like, no, we don't want to give you an induction for 35 for being over 35. I had to strongly advocate for it because for me, it was really important. I had other things going on. It wasn't just my age. But so that just goes to show you that different practices can look at the same data, and some practices are saying, nope, we're not doing inductions for AMA until people are 40 plus. And some are saying they strongly recommend, or, the ridiculous thing, I will not let you go past 39 weeks just because you're 35 years old. That's a little extreme. You're not, we shouldn't be seeing that too much.
I usually find that when it comes to induction, sometimes folks don't totally understand like why an induction is being recommended. And so like when folks are like messaging us like, oh, like they told me that only because I was advanced maternal age, I needed an induction. And I never liked, like, one, I'm not trying to give anybody medical advice on Instagram or any at all because I'm not a medical provider. But I'm like, okay, it sounds like you're not comfortable with this decision to induce. And so to me, it sounds like you need to have a little bit more in depth of a conversation with your provider on what things that they're concerned about. Because it might just have been like if you want to, go ahead. Or maybe their provider has really strong feelings about advanced maternal age. Or maybe there's another complication that hasn't been communicated to them in a way that they understand. And so I'm always like a really big fan of, if you don't feel comfortable with this option that's being presented to you, you need to get more information. And asking more questions is like a really good way to find more of that information that's available to you.
And it's hard because some people think that they can't ask any questions, that they're
Isn't
just
that
like,
so
you show
sad?
that
They don't
you're
know what to ask.
or they don't know what to ask. So it's like, oh, they're telling me I need to get an induction. Okay, I guess I guess I'll just do that.
What I teach people, I tell this to my members all of the time. The thing that's way underutilized by patients is actually telling doctors how they feel.
Yeah.
Because you might not be able to think of all of the questions, and actually having the right questions is kind of you need a lot of knowledge to know exactly what questions to ask. I spend a lot of my time with my members talking to them. They ask me, what questions should I ask? And I give that to them, because how would they know what to ask if you're not a physician, right?
Yeah.
So I tell people, tell them, that makes me really nervous. Can you help me understand why you think that's important?
I love
for me?
that.
So simple.
I
Just
love
tell us
that.
how you feel, because it takes the pressure off of you of having to figure out what to ask. And your provider, 95% of the providers, right? They actually they're human beings that want to help you. And if you say that makes you feel nervous and you're feeling unsure, they want to help you get to a place where you feel comfortable with the medical decisions that are being made. So I actually am not a huge fan of like all of the accounts that make people feel like they have to go into their OB office with like the list of like, well, this study said this and this. It's like, whoa, that's a lot that's a lot of stress to put on a pregnant person. It's a lot. If you think your provider is like not trustworthy, that's a whole other issue. But if you think that you have a reasonable trust in this person, just showing up and telling them how you feel can go a long way.
Absolutely. I think that comes back to what we talked about earlier of like, you don't need to know every little nuance to your medical situation or to your pregnancy. Like, you should have a provider that you trust to help guide you through it. And so if you feel like you have to show up to your appointments to fight, then we're already starting in a really bad place. And it's not going to go great. Like, not that you'll have bad outcomes, but it's going to be hard for you during your labor too, if you feel like you have to show up and fight. And I agree. Like, I see these pages that are like, you and your provider, like you're fighting the system and you need to be ready to advocate for yourself. And I'm like, yes, absolutely. Have preferences. Like, educate yourself on like what those preferences are. And when you feel like you're not sure on something, like, have a provider that you can trust to guide you through it. Like, that's a horrible place to start, feeling like I need to fight my whole pregnancy and my birth to get the experience that I want. I'm like, we're already not started. And it might have nothing to do with the provider. It might just have to do with the content that they're consuming. And it's like, yeah, because my first birth, I felt like I needed to be ready to fight because of a childbirth ed course that I took. And I was like, oh, like that doesn't sound like a good, like, and so I went in like really anxious for my labor, and I went really anxious towards the end of my pregnancy. And I had a traumatic birth experience. Like, maybe because of how the staff was treating me, but really because I came in really scared and I didn't know how to navigate the experience because I was so nervous about it. So like, yeah, the content that you consume on social media is so important. I think content creators need to be aware of like what they're putting out to their like followers as well. Like that's something that we try to be really like aware of as we create content is like, yes, like I have had frustrating experiences with certain types of people. Like I've had frustrating experiences with OBs and midwives and nurses and other doulas. I've had really wonderful experiences with the same type of people as well. And if I create content that talks about all my frustrations and the things that I'm pissed off about, like it's going to create this like story that everyone should be scared of all providers. They should be scared of the hospital. They should be scared of all these things. And like a responsibility of me as a content creator that's trying to educate is to understand how am I educating and how are people going to then take the information that I'm giving them and have an empowering experience? Or are they going to be really fearful of what it is that they're doing? And so they'll take my course because now they won't be scared because they'll know all my information. Like that's not a good place to come from. Like it's a great marketing tactic.
Maybe it's a great marketing strategy.
It's like,
I don't know.
Like we really pride ourselves on like obviously we have our biases. Everybody has biases, but
we also acknowledge that we have
to be as like even keeled between the two sides of like if you want this, if you want that, here are your options. Choose what's best for you. And that's something that I love about your page too, where it's just like here's your options. Like, here's some ways to navigate it with your provider and with the team that you choose, because the best decisions are the ones that you make, like not the ones that you feel coerced into, either by your provider or by the social media account that you follow. And it's the same thing with like advanced maternal age. Like, is this going to be something that becomes something that you become very fearful of because of the messaging that you're receiving or the way that your provider talked about it or the way that you see all these other people talk about it? Or can it be something where, hey, I have all these extra options now. I have all of this extra care that I can receive now. Like I had an option to have a more in-depth anatomy scan if I wanted with maternal fetal medicine, MFM, which I was like, I'm probably good. Like I don't want to drive an extra like half an hour to that appointment.
Yeah.
But if there's an issue, then yeah, I want to go and see them. Well, thank you, Dr. Sterling, for coming onto our podcast and talking all about advanced maternal age and navigating different scenarios with our providers. I love the content that you create on social media. I'm really excited by this Sterling Parents course that you offer, a mentorship that you offer. I saw that you have like a DM option or like a text option like directly to you, which I thought was super cool. It's like a doctor in your back pocket. Could you tell our listeners more on how they can learn from you, like where they can follow you, and then the course that you offer?
Yeah, so I'm at Dr. Sterling OBGYN on TikTok and Instagram. And in terms of advanced maternal age, I have a workshop called A New Approach to Advanced Maternal Age that's free. And that's at thebestpregnancyclass.com. So you can sign up. It's on demand. You can kind of watch it at your convenience. And it goes over a lot of the things I talked about today. And then Sterling Parents is a membership that guides people through the baby-making years. We're the only membership that is designed specifically to relieve the anxieties and worries of pregnancy and postpartum. And you have, some of the options come with direct access to me. And then everything comes with a database that you can search, so you don't have to use Google anymore. You can just get high-quality information and education to guide you through your pregnancy and postpartum experience.
Are there courses inside the Sterling Parents as well? I think I saw some that were like parenting classes or like how to breastfeed or something. Maybe I made that up.
We kind of do it all. So we do it. We like to say that we're a one-stop shop so that you don't have to go all over the place to figure it all out. So there's courses from me that guide you through trying to conceive and pregnancy. That's where I was talking about we can predict a lot of the mental load and worries, so that the courses are designed to address the concerns you have before you actually have them. And we continue that postpartum. So we have content from pediatricians, from lactation consultants, from pelvic floor therapists, that all of the things that come up in your recovery and with your baby, teething, introducing solids, breastfeeding issues, preparing for breastfeeding, we have classes that cover all of that. So,
that's awesome.
And we deliver them to you before the time kind of comes up.
Oh,
so
that's
when you
good.
start thinking like,
So you
oh
can
gosh,
prepare.
I thought about this.
You got to introduce solids soon. We're like, we've got you. This, it's a month away from when people typically introduce solids. Here's a class on introducing solids to your baby, so you don't have to like figure it all out.
That's awesome. I think that's a really great offering because you don't want to have to Google everything. Like
Don't-
Google's not a
just don't
horrible tool,
Google.
but like also it's very overwhelming and scary, and you don't have to like weed through information to figure out like what's good versus bad. Like you just have this resource that has it all for you from day one until however old your kids are. So I think that's a really cool offering that you guys have.
Thank you.
Yeah. Well, thank you so much for coming onto the podcast and chatting with us this evening. We had a really wonderful time. And we'll continue to follow you because I love your content as well. So thanks so much for coming on.
Thank you. Thank you for having me.
Thank you for listening to this episode. If you are over the age of 35 and you are trying to conceive, you're thinking about having another baby, or you are pregnant right now, and the label of advanced maternal age makes you feel really anxious, communicating that to your provider can be really helpful so they can either adjust the verbiage that they're using or they can further explain why they may or may not be concerned about your individual medical situation. If you enjoyed this episode, be sure to like and subscribe to our channel so you get notified whenever we release new episodes. We release new episodes every Wednesday and new birth stories every Friday. If you're pregnant and you're feeling anxious about labor and delivery, join our childbirth education course. We explain the science of birth so you can understand what is going on during your pregnancy and during your labor, because when we don't understand things, we tend to be afraid of it. And so this can be the first step towards feeling empowered in your birth experience. If you want to know how to exercise throughout your pregnancy, because there are so many benefits to prenatal exercise, you can join our online prenatal fitness programs. And you can bundle our childbirth education and prenatal fitness together to save an additional 15% off.
If you're postpartum, we offer a postpartum education course where we go over what to expect in the postpartum, as well as newborn care, infant massage, and infant and toddler CPR. And then if you're looking to return back to fitness in the postpartum, we have postpartum fitness courses. If you're a professional and you want to learn more from us while earning continuing education credits, we have a prenatal postpartum fitness trainer course, as well as a birth workers course. And as a thank you for listening to this entire podcast, you can use code STORY10 to get 10% off any of the courses that we offer. And this podcast is sponsored by Needed, a nutrition company focused on the perinatal timeframe that both Gina and I have used during our pregnancies and postpartums and still to this day. And you can use our code MamastePod at thisisneeded.com for a discount.